Thank you very much for the opportunity to speak to you today. As I say, I'm the principal in the mental health unit in the department, so we do deal with the whole range of mental health policy legislation, the estimates, service planning and the suicide reduction strategy. And Minister Daly, for example, has outlined to you the significant initiatives that are currently underway across the sector. So I thought from a departmental perspective, I would like to focus particularly on the current direction of our mental health policy. At the heart of the policy, as you know, lies a commitment to move towards a community-based mental health service. This was a central recommendation of a Vision for Change, which was published in 2006. This was a 10-year programme, and a vision advocated a holistic view of mental health and a multidisciplinary approach to addressing the biological, psychological and social factors that contribute to mental health problems. It also advanced a move away from traditional institutional-based care to a patient-centred, flexible and community-based mental health service. A person-centred treatment approach through integrated care plans reflecting best practice would be agreed between both service users and carers, and the shift towards community and community-based supports was underpinned by population-based mental health catchment areas with specialist expertise provided by the community mental health teams. These, of course, will be expanded teams of clinicians and health professionals who work together to meet the needs of service users across the lifespan. Now, as we have acknowledged, implementation of Vision has been slower than envisaged, but the pace has picked up in recent years. The establishment of the HSE Mental Health Directorate in 2014 delivered on a key recommendation of Vision, carrying as the division does within the HSE operational and financial authority and accountability for all mental health services nationally. This gave us visibility of the budget and the means to monitor and manage and enhance that budget over a period of time. The HSE service plans from 2014 onwards, therefore, set out key objectives in line with Vision to advance the shift to a preventative and recovery-focused approach among service users, with the associated cultural change that this brings for those working across the services. And that's a significant change that we have all seen right throughout the whole mental health sector. The division's work has been greatly assisted, of course, by the additional funding that the Minister of State outlined and the ongoing development of community-based teams, as well as the initiation of more specialist services and clinical programmes. This reflects the opportunity the extra funding presented, and it has been very welcome because the division in the HSE has been able to open up a number of areas that really were on the agenda since Vision was published, but really were on the back seat while we were trying to basically build up and solidify the community teams in themselves. So overall, the approval of additional posts across the community teams, despite the recruitment challenges, has assisted in underpinning and consolidating the services. As Minister Daly noted there, the process of renewing our policy is now underway. I just wanted to give you some brief update on that. The main themes for Vision for Change really do remain relevant today. It has been a very lasting document in terms of its overall principles. It was very visionary, minding the pun there, but rather than rewrite the policy entirely, it was decided best just to revise and update the existing policy, taking account of the advances made within the sector and current thinking and best practice on mental health nationally and internationally. So to commence this process in late 2016, the Department commissioned WRC consultants to conduct an external evidence and expert review as a first step to determine the parameters of our policy revision. Essentially, we asked WRC to go out there and look at what is best international practice, what's going on, what has worked best with the implementation here at home, what can we learn from different countries. Their work ranges quite widely, and they really did extract quite interesting examples of best practice from many different jurisdictions. The completed expert review was published in July, and it's on our website and provides evidence to determine the updated policy direction that we are taking. The expert evidence review highlights topics such as the current situation in services in Ireland, the need to prioritise mental health as a major societal issue, primary prevention and positive mental health, recovery, social inclusion and living well with mental illness, mental health care provision, system governance and financing. At the same time, Minister Daly appointed Mr Hugh Kane as chair of an oversight group to oversee the development of a new policy. Taking account of the outcome of this expert review, Hugh has wide experience in the social care area. He will be known to many of you from various areas working across the HSE. The full membership of the Oversight Group will be announced by the Minister of State in the near future, and there will be an opportunity, of course, for stakeholder input into this process, as is always the norm in these cases. The Oversight Group, of course, will also have the benefit of the outcome of the National Youth Mental Health Task Force and the Youth Mental Health Pathfinder projects, and the reports for these will be published in the coming weeks. The Pathfinder in particular predates the task force and is trying to look at how across government departments in particular we can get our act together much more in a much more coherent way rather than working in the silo arrangement, which tends to be a feature of our public service generally. So, with the policy process getting underway, the themes to be discussed here today are very timely. Across a range of these themes, I notice they include service user involvement, the recovery process, eating disorder issues, perinatal mental health, and all of these are new priority areas for the HSE Mental Health Division and have the support of the Minister of State and the Department. They're not the only areas. I'm giving examples here. Psychiatric and mental health nursing is central to the delivery of the services. And the mental health unit, which I lead, is in the same departmental division as the Office of the Chief Nurse. We're both working to depart Dr. Siobhan O'Halloran, so we find common themes emerging in our areas of work with yours on an ongoing basis. So I think your discussions today will be of great value to us in updating and renewing our policy. I'd like to sincerely thank the Office of Nursing Midwifery Services for the chance to talk to you today, and I wish you the very best for the conference. Thank you very much.